Hi all, welcome to Raaonline. Today we are going to see one important topic, that is nothing but what are the various effects of cardiopulmonary bypass on various organ and how do you protect this organ during cardiopulmonary bypass. When you put the patient on cardiopulmonary bypass, there is blood contact with an artificial surface. There is going to be surgical trauma. You are going to do cardiac surgery, and once you rewarm and come off, there is going to be reperfusion. So ischemia reperfusion injury can happen, and you have to anticoagulate the patient to go on a artificial surface. So there will be blood loss and coagulation activity will be altered. All this can lead to complement system activation, cell activation and endothelial activation, which leads to a cytokine production, cytokine storm and systemic inflammatory response syndrome. So how you are going to protect the organ from this deleterious effect? The main organ affected by this various etiology are, the first and foremost, you have to protect the brain, followed by heart. Although you are doing cardiac surgery, cardiopulmonary bypass cause major effect on heart. Then comes acute kidney injury, your pump lung and your GI tract, followed by your immune system and the hematopoietic system. All the various systems which are affected by cardiopulmonary bypass. Apart from that, few other etiological factors are very important to cause organ damage. The first and foremost is hypothermia. When you go on cardiopulmonary bypass, you reduce the temperature to around 32 degrees Celsius to 28 degrees Celsius. This hypothermia can cause various organ damage, and your bypass may be non-pulsatile. Nowadays pulsatile bypass is there, but it is a non-pulsatile flow and you are artificially perfusing the system using cardiopulmonary bypass. It is cardiac bypass and pulmonary bypass. Your cardiac output is bypassed, your oxygenation is also bypassed. Both comes artificially. So it is not natural to have an artificial heart and lung. So that is another etiological factor. An intense inflammatory response to perfusion with artificial, because this artificial is non-endothelial surfaces. So inflammatory response can be exaggerated. Another important thing is you use cardiotomy. By using this cardiotomy and suction, you reintroduce fat and particulate debris as well as inflammatory mediators from the surgical fluid into the systemic circulation. That is another important trigger for causing this organ damage. And third is you are breaking open a large bone, sternotomy. You are breaking open the sternum and putting a skin incision, and your pain response, everything should be adequate. The surgical stress and pain also plays a major role in organ damage. To come to the cellular effect on this organ damage, you are giving a cardioplegia and arresting the heart, and later you reperfuse the organ. So there is chance of ischemic reperfusion injury, and this might alter your vasomotor and myogenic tone. There is going to be endothelial activation and inflammation. This vasomotor tone can trigger vasospasm and impair perfusion to all organ system. And here the endothelial can lead to oxidative stress and microvascular injury. The microcirculation will be compromised. This leads to multi-organ damage. This is at the cellular level. Now coming to the complication, what happens to the various organ system? In the heart, it is going to be myocardial infarction. With brain, it is going to be transient ischemic attack or a stroke. Kidney, there might be acute kidney injury. And with lung, there can be an ARDS like picture, which is often called as pump lung. And your GIT might be compromised. There might be hypoperfusion and paralytic ileus. All this can lead to a prolonged requirement for mechanical ventilation. If one organ is damaged, you have to ventilate little bit more. This becomes more common with pump lung. And apart from that, wound infection, bleeding requires transfusion and re-exploration are very common with cardiopulmonary bypass usage.